Hello, my name is Dr. Angela Lamarca. I am one of the medical oncologists at the Christian NHS Foundation Trust, and I am going to present today some data on the role of molecular profiling for cholangiocarcinoma, especially a review of the literature looking into which are the main targets that we may identify in patients with cholangiocarcinoma. As we all know, cholangiocarcinoma are rare malignancies, and the first-line treatment in the advanced setting is based on chemotherapy with cisplatin and gemcitabine from the data of the ABC02 as the current standard of care. There is some new data also showing the potential role of immunotherapy from the TOPAZ-1 clinical trial that was very recently presented. In the second-line setting, the standard of care is also in the form of chemotherapy with FOLFOX and FOLFIRI from the ABC06 and the NIFTY clinical trial data, respectively. However, we all know that targeted therapies and precision medicine approaches are really changing the paradigm of treatment for patients with cholangiocarcinoma, and therefore performing molecular testing is very important. Some of the main targets, or the most known targets and the most recognized targets relevant in cholangiocarcinoma are FGFR and also IDH. However, we wanted to perform a literature review to assess which other targets we should really be focusing on when we are doing molecular profiling for patients with cholangiocarcinoma. We therefore performed a literature review, as you can see here, looking into the PubMed, and we are here in this slide providing specific details about the literature search that we utilize using the PubMed tool. The searches were also performed for the most relevant conferences. The most frequent genomic alterations identified in cholangiocarcinoma were on the genes p53, CDK2A and B, KRAS, IDH1 and 2, and also FGFR2. And among these, the ones that we can actually target are mainly IDH1 and 2, FGFR2, and some of the genes involved in the RAS, RAF, MEK, and ERK pathway. Within the IDH1 mutations, there were some data looking, providing information for management with ivosidenib and also with some of the PARP inhibitors, for example, olaparib. For the FGFR2 gene fusion, there are multiple drugs being developed at the moment with FGFR inhibitors, some of them actually approved for its use, for example, in infigratinib and pemigatinib. And regarding the RAS, RAF, MEK, and ERK pathway alterations, these are also being targeted, for example, with RAF and MEK inhibitors. There are also some KRAS inhibitors being developed at the moment in here. I will show you some of the tables with the main treatments options. As we can see here, these are targeting IDH1 and IDH2. The prevalence is between 14 to 18% for IDH1 alterations and between 5 and 7% for IDH2. The prevalence of FGFR2 fusions were around 7 to 19%, depending on the studies reported. And finally, for the MAP and the ERK pathways, we were ranging between less than 3% for BRAF, around 12 to 27% for KRAS, and again, less than 5% for NRAS. Regarding the IDH1 and 2 inhibition, as I mentioned previously, we are not only having the IDH1 inhibitors, but also other drugs, especially PARP inhibitors, for example, olaparib, that may be of interest in this patient population. For the FGFR2 the fusion patients, as I mentioned previously, there are multiple FGFR inhibitors being developed, and some of them are already approved. And you have in this slide a summary of the phase 2 studies that are supporting the use of these treatments in patients with cholangiocarcinoma. Finally, when targeting the MAPK pathway, the evidence is again based on phase 1 and phase 2 studies. The evidence is probably not as strong with the binimetinib. We are really at early stages of this development of the drug, but we have, for example, stronger data with dabarfrenib and trametinib if there is a BRAF mutation, for example. To conclude, this literature search is identifying not only FGFR, but also IDH as potential, it's not only FGFR and IDH, but also other molecular alterations as potentially targetable for patients with cholangiocarcinoma. These treatments are well tolerated, and we do have evidence to show that inhibition of IDH and FGFR are of clinical benefit for our patients. But there are also other targets that we can utilize as precision medicine approaches. And as I have shown you, there is phase 1 and phase 2 evidence supporting the use of those treatments. The targeted personalized treatment has the potential to improve patient outcomes, and therefore performing molecular profiling for patients with cholangiocarcinoma is of huge importance. I would like to thank you all very much for your attention. Also thank the people who have been involved in developing these slides and this poster. And I attach here some of the most relevant references for your review if you wanted to look further into the data presented. Thank you very much.